consultant at Dr. Hans Center, which is in New Delhi. We are basically a team of ENT surgeons and cochlear implant surgeons. Today I will be telling you about what is the treatment options that are available for hearing loss. We have hearing aids as well as cochlear implants for hearing loss. Cochlear implant device is something which I will be telling you today about, because this is something that people don't have enough knowledge on, and also the awareness factor is on the lesser aspect. The cochlear implant device comprises of two parts, which is one is the operative device, which is implanted into the patient, and an external device which is called as a sound processor, which fits onto the inner device. It can be either sitting behind the ear or it can be sitting off the ear. And the cochlear implants are done for people who are having severe to profound hearing loss. Now we do cochlear implants for both children as well as adults. Now if you do cochlear implants for children, generally the children who are congenitally deaf are the ones who are in alignment for cochlear implant surgery after a series of investigations and evaluations. If a child is born deaf, congenitally deaf, the child has to be evaluated at birth for hearing loss. There are few certain investigations that need to be done and can be done very easily even by the hospital nursing staff, which is the otoacoustic emissions. This will give a clear indication whether the child is having any hearing loss or not, and this kind of early neonatal screening will enable the doctor to put the child onto the right track for treatment at the right time. The child will be further evaluated if the child is found to be having negative response in the otoacoustic emissions, and the child will undergo auditory brainstem response evaluation as well as further radiological assessments, following which the child is decided whether he or she is a candidate for cochlear implant surgery. By the age of 8 to 9 months, with all these investigations being done for the child can undergo cochlear implant surgery. That is the earliest age group that we can do cochlear implant surgery to enable the child to achieve the best possible outcomes. The possible outcomes are in terms of hearing as well as in terms of speech. The earlier you implant the child, the better the child's brain will respond to sound, better will be the perception of sound and the comprehension of sound, and the better will be the progression in terms of spoken language. The more earlier we put in the receptive language into the child's brain, the better would be the expressive language, which is speech. Now, as you delay the age of implantation, the outcomes in terms of hearing as well as speech will vary. The best age group to implant children would be between 8 months of age to 2 years of age. Also, the best option to give to such children would be to implant both ears at the same time, if not implant one ear after the other ear. These implants will provide the child the ability to get sound into the brain, which eventually the brain is the organ which does all the listening. The brain will eventually process this sound and then in turn stimulate the speech area, and in turn the child will be able to speak. Now, how does the implant work? The external device, which is called as a sound processor, will receive the sound signals from the external environment, convert it into a digital format, and then send it across to the implanted device, which is put in surgically into the child. The implant device which is put into the child will convert the sound signal or the signal which is received from the outside into electrical impulses, and the electrical impulses are transferred via the electrode which is placed into the cochlea. Now, the sound can be varying from high frequency to low frequency and can be of low intensity or high intensity. So there can be sound signals around more than 40,000 signals per second to 80,000 signals per second can get processed by the implant at a time, depending upon various types of implants that are available. And these signals are in turn picked up by the nerve, and the nerve takes it to the brain. By doing this, the brain, which actually receives the electrical impulses, will be able to decipher what the sound is based on the signals that has been sent to the brain, and then analyze them and then store them in the brain as a language bank. Once the language bank is formed, this language bank will enable the further stimulation of the speech center, and the child will be able to speak in terms of expressive language. Okay, so if you need to get in touch for or have any queries for cochlear implant surgery, there are certain set of investigations that have to be done initially for the child. And once these things are done, then the child can be evaluated by the implant surgical team and also by the team of the audiologist as well as a therapist. And as a teamwork, the child will be taken care in order to achieve what is called as hearing and what is called as speech. Also, cochlear implant surgeries are done for adults. Now, when you do cochlear implant surgeries in adults, these are the adults who have been hearing and speaking all their lifetime, and because of various reasons they have had hearing loss. Now, these adults also require to undergo radiological investigations to understand the structures of the cochlea and the nerve, following which they also can be implanted with the cochlear implants. And once they are implanted with the cochlear implants, all that we are doing now is we are providing the brain the sound signal which was not being received by the brain because of hearing loss. And once that is received, the adult will be able to understand the sound signal over a period of time, and of course the adult is always speaking. Now the patient will also have a coordination between hearing as well as the speech, and the patient can lead a normal life. Now the adult group can be anywhere between above 18 years and up to 80 years. So we have had various people coming in for cochlear implants in the adult age group who have even undergone cochlear implants for 1 year as well as on both sides. And also we have had adults who had single-sided deafness, that is deafness in only 1 ear, complete deafness in 1 ear, but the other ear being normal, who want to hear from the other ear. They are also being implanted at Dr. Hans Center. So for any further queries regarding cochlear implant surgery and how to select the candidate or the patient for cochlear implant surgery, you can contact us as mentioned by the team, and then you can get in touch with us, and then we can further evaluate the patient for surgery.